For this technique, we will use a 10 ml syringe with a green needle and a vial of heparinized saline. The first step is to draw up a little heparinized saline into the syringe. This is then drawn up and down the syringe as shown. The saline is then expelled, leaving the needle and syringe flushed with heparinized saline. In this specimen, there is a palpable lesion simulating a thyroid nodule or a lymph node. It is not common practice to use local anaesthetic for this procedure, but this may be required if the patient is particularly anxious. In order to obtain some cells for cytology, the needle is passed directly into the lesion as shown. Once the tip of the needle is inside the lesion, the plunger is pulled back with the thumb, whilst keeping the syringe and needle in place with the other fingers. Multiple passes are needed through the lesion to collect an adequate sample. The needle is then removed, and you should have a small sample of aspirate in the green portion of the needle. Using a pair of slides, pre-marked with the patient's details, pass a small amount of aspirate onto one slide as shown. The other slide is then passed across the first to form two smears. One slide will then be air-dried and the other sprayed with a fixing agent. The rest of the aspirate can be placed in a pot with some saline to be spun down for further analysis.